Welcome to another episode of the Chronic Comeback Podcast. Today we have got on the show Dr. Perry Nickelston. He's been on the show before. Please check out the other episode. That was a lot more practical. Some of the stuff we talk about, he actually shows you how to do it in that episode. We didn't quite have that time today, but we went into detail on a lot of other stuff, answered some of your guys' questions. He's full of life, full of enthusiasm, full of passion. And it really made me feel like there's additional things that I can be doing, but not in an overwhelming way. So super excited for you guys to listen to this today. So let's go, guys. Perry, welcome back to the show. How are you doing, my friend?
I'm doing wonderful, my friend. Thank you so much for having me back. Great to be here.
All good, all good. So yeah, we let our audience know that we were having you on the show, and there's been a few questions. But if you could, for those, because we've had so many episodes now, it's unlikely that everyone's watched every single one of our episodes. Well, maybe some people, but if you could just give us a little bit of a background to yourself, how you're doing the work you're doing today, and a bit of an overview of that work, that would be great.
Sure. I'd be happy to. I don't know if I can make it quick, but I'll try for sure. So,
Yeah.
well, Dr. Perry Nickelston's my name. Some people call me the Lymph Doc, and they call me that because I called myself that first. Because I do a lot of work with the lymphatic system to try to help people that are suffering from chronic pain, autoimmune disease. I say it's for people that are lost in the quicksand of inflammation, and they just feel like they're in the abyss, if you will, a little bit lost. And so I see people in my world who've tried a lot of different things that may have not helped, or they helped for a little bit, but stuff came back or didn't help at all. And they're like, I don't know what to do next. That's usually when you find my name, or you come across my work. And my business name is Stop Chasing Pain. And that kind of speaks for itself. And what it means is I want you to treat where you have pain for sure. But if that doesn't help you or fix the problem, that's the first indication that you should look somewhere else and then not chase where the pain is. And that brought me pretty much to where I am right now.
That was quick. Thank you for that. So, because a lot of people listen to this, I think they get lost in there. So people will be listening to this, they'll have, Crohn's, chronic fatigue, chronic pain, all different kinds of things. I think people get lost in their own diagnosis and say, okay, if this isn't very specific to what I've been diagnosed with, then, that doesn't make sense for me. And I guess, your Instagram, your business, Stop Chasing Pain, people will think, oh, well, that's just chronic pain. But for me, and I'm sure for you, and you said autoimmune disease as well. So someone listening to this who's doesn't really have pain, how is this applicable to them? And is it applicable to kind of all chronic illness, really?
Yeah, it really is, and I feel you with people who kind of become their label or their diagnosis, right? I mean, that can pull you into the quicksand right there as soon as you get a label.
Mm.
And then when you start learning more about your label, you fall further into the abyss. But see, well, pain is normal. I mean, we're supposed to get pain. It's a part of being a human being. That's what shows that you're alive. Because there are some people that don't feel pain because of damage to their system, are born that way, and they die really quick because they can't interact with the world and know when they should not do something or stop doing something, because pain is a protective response to get you to hopefully not die. That's the first step that you want to do. But pain should eventually go away, right? But when it doesn't, that's when it's considered chronic, right? And usually it's about 4 weeks to 6 weeks when something doesn't go away, that can be considered chronic. So if stuff goes away with pain, well, thumbs up, that's great, awesome, keep doing what you're doing. But what if that same pain keeps coming back? Well, that's something different, right? And in my world, I honestly don't care what your diagnosis is because I know the underlying cause of whatever the diagnosis is inflammation in the body that's gone what I call amok. It's just gone stir crazy and it's not able to turn itself down or calm it back from being inflammation fire like that. Okay. Because the inflammation is also not a bad thing. And you need inflammation because that's how it actually kills things that's trying to kill you. But inflammation is also part of the repair process.
Mm.
But when it gets stuck that way, then it moves on from repair and then it becomes more into a breakdown of the body. And that's what chronic pain is and chronic disease. I know when you have those, you have inflammation somewhere and probably a lot of wheres that you're not aware of, even in the brain. Because if you have inflammation in the brain, that will 100% influence how much pain you feel.
And how much of your thinking and work like overlaps with the likes of like John Sarno and his work? Is it an exact match, or is it just overlaps a little bit? Like, could you just give us a little bit of detail about that? Because that's
Probably a little bit of both.
yeah,
Yeah, probably
okay.
a bit of both, like an exact match and an overlap. And then I take some concepts that I learned from other people and I run with it and make it my own. Right?
Yeah,
Because there's really nothing original in the world. It's somebody sees something there and then they take it there and they split it with this and that, and then you hybrid it together, and then maybe you can create something new. But that was very, very influential in my work, Dr. Sarno's work. It's actually one of the top things that I talk to my patients about when they come to see me, because you don't see me when pain first starts. You see me when you've had it for a long time and everything you've tried to help doesn't help it. So then your thinking process also automatically has to be different, because if your thinking process was right and tried to help yourself, you wouldn't be in pain anymore. Does that make sense?
yeah.
So I have to automatically switch my pathway with where I'm going. And the reason I love John Sarno work I came across is TMS, the tension myoneural tension myositis syndrome. That explained a lot for me, and that's exactly what I tell every single patient that comes to see me, because, one of the number one causes, and I'll tie this back to TMS in a second, is, incessant stress, never-ending stress, okay? And that response to stress is what's called the sympathetic fight or flight nervous system. Another term is hypervigilance, hyperarousal, where you're always on and you never turn off, okay? That's gonna create inflammation. But when you are in sympathetic dominance, that causes excess tension in the body. And that excess tension, just to review TMS, tightens up tissue.
Mm,
And tight tissue doesn't accept blood flow well, in or out,
mm.
both ways. And that's kind of a big deal because that's the only way that anything gets to and from a cell. And when cells don't get what they need, they're going to tell you, and it's going to be pain and it's going to be inflammation, right? And syndrome means that it can happen anywhere in the body when you get it. So you can calm tension down through, body work and massage and doing things right to tissue, but you also have to learn to calm the nervous system down overall to get yourself out of that fight or flight response. Because if you don't ultimately do that, everything will keep coming back. And that's where the role of your emotions come into play. And he talks about rage a lot, anger a lot, right? Because that's a lot of tension going in the body. So that's the emotional aspect to how you're responding to things that are going on in your life. Well, that also comes down to the brain, because the stories you tell yourself are for how well the brain works. So it goes back to what I was saying before, is that if you have then, poor blood flow to the brain, poor blood flow away from the brain, poor waste management from the brain, you have neuroinflammation, then your brain doesn't work as well. So it's hard to take yourself out of fight or flight even when you want to, because your brain's on fire, right? And then when that happens, you lose the ability to effectively and efficiently inhibit pain. It's called the pain inhibition pathways that come from the brain. Because the brain is where pain comes from. Pain doesn't come from the tissues, it comes from the brain. So it's a really good idea to make sure your brain gets everything it needs. So when you're in TMS, that can influence that supply chain to your brain, but it works both ways. You can have a poor supply chain to your brain that feeds TMS. So what happens is you're in the quicksand. And you're like, I don't know how to get out of it. And the key is you have to do things to increase your blood flow and your lymph flow and calm the nervous system down at the same time. Does that make sense?
Yeah.
So I've always been fascinated. Like, one of the things that led me into this work that I'm doing is my own suffering, where I was really sick and damn near died, and nobody could help me and figure it out. And even I couldn't figure it out in the beginning because I didn't get sick enough to have to think differently. Does that make sense? Like, everything I knew up to that point to try to help myself was not working. So then I went down what some people would call the crazy path, but it's not so crazy because that's where you find your answers most of the time. But even before I got sick, I was always very frustrated when I first began to get into care, because I was always fascinated with why all this stuff keeps coming back on everybody. And then no matter what we do, everybody seems to be getting worse. I mean, what's up with that? There's got to be a reason, right? And I think, at least from the work I'm doing right now, I found some answers to that, because I know it brought me back from the quicksand. And then if it brought me back, I thought, well, you know what? Maybe it'll bring a lot of other people back. And guess what? It does.
Yeah. Yeah, definitely. And with I feel that with a lot of what you talk about the brain, but if we go to like mindset, for me, the biggest like limiting factor in the initial part, initial, middle, and towards the end part of like me starting to actually make improvement was my own mindset and attitude towards like what was actually like causing this, and letting myself truly believe that my brain and the way in which it was working, my nervous system, was the biggest enemy here. Not enemy, but you know what I mean? Biggest factor here. And it wasn't, some bug that had come in and infected me. It was, it was that. And so when you have people come in, I don't want to put words in your mouth, but I imagine the biggest limiting factor you have with someone getting better is them like buying into what you're saying and fully believing it. Would you, is that right?
Not for me. The
Okay.
reason being is because they've been to so many places and tried everything that's supposed to work, and all the experts and specialists and everything that's got mountains of research behind it. And they're like, I don't feel any better, or I feel worse. Or if people can't even find anything, right? Like, how many people listening, or you may know, say they can't find anything on my blood work. They can't see anything on an MRI or an X-ray, but I'm always in pain. It moves all over the place and I can't get out of bed. Well, they're going to tell you typically that person's got anxiety or depression, or it's all in your head. That's about the first thing they said that's halfway right, because the brain's involved with that, but not how you think it is. And so they're just not looking at it from the right perspective / paradigm. Okay. So when you've gone through all that, and you come in to see me, you're ready. Like the buy-in's already there because like I mentioned before, you don't knock on my door first. You knock on my door last, which I love. And I'm going to tell you why. Because one, you're finally ready, right? But two, that really helped me create and kind of mold how I work with you now because I know up to that point, so many things that they've tried already hasn't worked for you. So I'm not going to do those. Does that make sense? Because if you needed those, you wouldn't be with me. You would already be better. So they've done the x-ray, they've done the MRI, they've done the blood work, they've done all that. So I don't have to do all that. Right? So I don't have to rule out that somebody missed your cancer or something like that. So all these people have gone through all of this data, and the data's got information in there. They're just not seeing it, is what it is, because you have a tendency to find what you're looking for, right? Or you don't even know what the hell you're looking for. And the reason that inflammation is so tricky is you won't see that typically in blood work until it reaches a certain level. And you really won't see what they call systemic inflammation, which is inflammation everywhere on an MRI or an X-ray. You may see isolated inflammation, but that's easy. I mean, that's just like point and treat, that one. But it's the systemic inflammation that's driving everybody bananas, and that's what chronic disease is. And that's why the current medical model is broken, because it doesn't know what to do with it. They like to go after just like one thing, one cause. Well, I hate to tell you this, but there's no such thing in the world of chronic pain. There's a lot of things that go into it, right? So by the time you reach me, you're already there. And then when I explain it to you of why you are where you are, they get it. They go, oh, now I get it. And then one of the first things they tell me is this: why in the hell didn't anybody else explain this to me like that? And then my next question is, that's really good. You should ask them that, because they should be.
Yeah.
Right? Because part of the reason that you may be suffering and lost is that it's an inflammation. It is because you feel lost. Like you don't have answers. You feel like nobody's listening to you. They're just disregarding you, or they're going to throw you into a label or diagnosis, and they're going to try to give you the same treatments that everybody else gets that might not work for you because you're the individual person. And it's really terrifying sometimes when there's so many possibilities that you don't even know where to start. That also freaks people out. But the number one stressor for the human nervous system, I learned this from a neuroscientist, is uncertainty, not knowing, and lack of control. What do you think chronic pain and chronic illness is? That's it. Exactly what it is. Now, what I'm going to contend is you probably had a lot of uncertainty, not knowing, lack of control in your life long before your pain hit. And that's one of the contributing factors of why you got it in the first place. Because I always have this question: why today? Why not yesterday? Like, why do you have a physical pain today, or you have these symptoms now, but you didn't have them 5 days ago, or you didn't have them last year? What's up with that? Right? So what I mean by that is that it's different from acute trauma as opposed to trauma that comes up slowly. Like if I hit you in the knee with a baseball bat, that's a pretty easy puzzle to figure out. And I know what the causation of your knee pain is, and I pretty much know what I have to do to put that together. And that's really good for a surgeon at that standpoint. But that's vastly different, man, than somebody who didn't have knee pain last week or yesterday, and then they wake up the next day and the knee hurts. Totally different mechanism you have to go after repairing. And I'm going to tell you one thing: you better not just look at that knee. it's going to be coming from somewhere else. It just showed up today. And what I'm going to contend is your body's ability to compensate and adapt and try to do whatever it can to prevent that knee from hurting you wore out. And then now it's asking for help. That's what pain is.
Could you tell, so someone comes to you, and let's say, I know we're talking about pain a lot here, but like in general, they're suffering with their health, not just pain. They've got extreme fatigue. There's just a lot going on there, and they've exhausted they've done all the tests, they've done everything. Because I know people will be listening to this and feeling overwhelmed, just like thinking about all the potential things that, they might have to do. What is the like simplified approach that you would take with someone, like initially, and where would you focus? Because I know you talk a lot about the lymph, and so I'd love to hear a lot more about that.
For sure. Well, it's really simple. I got a 3-step process, and I'm about to break it down. Number 1 is calm the body. Number 2, move the fluids. And then people say, which fluid? And my answer is yes. All of them, particularly your blood flow and your lymph flow. Because if those don't move, you're in big trouble, like super duper uber big trouble, man. And step number 3 is heal. Because you will never reach step 3 until you do step 1 and 2. So calm the body means I have to take you out of that fight or flight, sympathetic dominant hyperarousal state. Okay. Any way that I can figure that out, like however it's going to take you. That's what people struggle with, though. People struggle taking themselves out of fight or flight, right? They try to. They'll try to remove themselves from the stressor. They'll try to do vagus nerve work, which you may have heard of before, and people listening, where you work a nerve in your body that is helps calm the body and control inflammation, right? Surround yourself with better people, do different therapies and stuff like that. And sometimes that helps. But what I find in my world is people say it helped, but you know what? I can't stay there. Like, I feel like it keeps coming back and I don't know why. And in my world, the way I approach it, the reason is because you've got such poor blood flow and lymph flow around where your sympathetic nervous system lives that you can't come out of it. Because the sympathetics need blood flow and lymph flow too. And if they don't get it, you're going to stay in sympathetic dominance. Do you follow that logic there? Okay. So what I do is I work on the physiology and the anatomy of where these fight or flight systems live for you and teach you how to do it so you can calm the body down that way in conjunction with doing what you're already trying to do to calm the body. You're just struggling to do it because you're fighting physiology at the same time. Does that make sense? Okay. Because your sympathetic nervous system comes primarily from 2 places. Spine is number 1. Your sympathetic fight or flight system lives in your spine. That's one of the most important things that anybody listening to this podcast will ever learn. Or if you learned it and you forgot it, here's your reminder. Okay? And then the second place is your abdomen. Because the sympathetics from your spine go to your abdomen. So those are the 2 places that you need to spend the most work on in my world. And most people don't. They haven't looked at it because they're too busy chasing the painful body parts instead of looking at that. And when you can calm those sympathetics down, you automatically improve fluid flow. And here's why. Because the sympathetic nervous system is controls the vasomotor system. That's the blood flow and lymph flow. It constricts flow. So it's basically the TMS to your blood flow and your lymph flow is what that is. So when you get into the tension myoneural syndrome, your anger and rage, you're stuck in sympathetic fight or flight. The first thing that does is constrict blood vessels, both ways, and lymphatics. And when you constrict those things, you slow flow down. What happens if you stay that way week after week, month after month, year after year? You're not going to die right away. You're going to slowly deteriorate. And then you're going to starve your cells and your tissues of oxygen. That's called hypoxia. And that's what TMS is. You increase tissue tension, you decrease blood flow, which decreases oxygen delivery to the cells, causing hypoxia, and pain shows up. Right? But when you also decrease blood flow in, you decrease blood flow out. Right? Of course you do, because they're pipes that travel with each other, right? So that means you can't get waste products out either. And then the waste products stay there. And when waste products stay around tissue and blood flow can't get to tissue, I'm going to give you one guess what shows up: inflammation. And then after inflammation shows up, what shows up next? Pain. Pain. Right? Now, what most people need to know is they probably got inflammation in the brain, because you constrict the blood flow vessels to your brain as well when you're in sympathetic dominance. So when I work with people, I just come at them because from a physiological standpoint of understanding where these systems are, how they talk to each other, what happens to them when you get stuck in fight or flight, and things that you can do to try to rebalance them out, and then understanding the physics of how fluids move in the body. When you can nail I'm going to tell you right now, man, if you can nail those two things, you see changes that'll blow your mind up, because you're giving the body what it needs to do its job, which is to heal, recover, and regenerate so you don't stay in pain. So maybe one of the reasons that you're in pain is because it doesn't have the tools it needs to get you out of it. Right? And that tool doesn't mean you have to take the pain medication. You may have to, because I don't want you to suffer. I don't want you to be in pain, because pain also feeds fight or flight. Right? So if you can just come from that perspective, with those two simple steps, I mean, it's really simple. You can make profound changes in the body. Okay? It's not really complicated.
So from the calming point of view, which is the first step, people do a lot of different things. Myself, I've tried a lot of different things. What's working for me right now is a mix of breath work and yoga nidra that I've been doing. That's like really helpful, but it's not localized to, I'm not doing anything specifically on you mentioned about, your spine. You mentioned about your abdomen. How would you do something which is more specifically localized to those areas? And then also, how would you know you've calmed your nervous system down enough that you can move on to step 2? Does that make sense?
Yeah, well, good question. So you'll typically know when your nervous system is calmed down, because you'll begin to notice changes that happen in the body in relationship to tightness, tension, pain, discomfort. Your symptoms will typically calm down. and your tolerance level for stressors increases. Because what happens is when you're stuck in hypervigilance, fight or flight, it's kind of like PTSD, right? You ever see somebody stuck in that? They can't handle a lot of sensory input because they're overloaded. So loud noises, lights, things like that, or even social environments. It sends the system into the emergency mode quicker. So you lose your tolerance for stress. So an overwhelmed nervous system is really easy to overwhelm.
Mm.
And that's also one of the reasons that I found in my work why many people don't get better, because they're doing too many therapies to try to get better at once, and they're overwhelming the system, the body's ability to tolerate the therapies, even though they're good ones, right? Because everything that you do to your body stresses the body. So therapeutic interventions are also stressors. So if you have a low threshold for stress, it doesn't matter what the stressor is, it's going to overflow your bucket, right? So then you'll start to notice that when you begin to work these areas, you have a bigger distance now between what would set you off before and what doesn't set you off right now. So maybe that means, I feel like I can walk longer. I feel like I'm less tired or fatigued. I don't get as snappy or as angry because your bucket, what they call the threshold, is increasing. So then you have a lot of room to work with where things don't set you off. But now everybody is set off. I mean, you just go into the modern world today, everybody hates each other. And there's so much rage going on, like boom, they're just set off. So everybody's in TMS right now, whether they know it or not. And then I'm going to tell you right now, there's a lot of people that are going to be in some serious pain rolling around the block for them pretty soon. Okay. But that's how you'll know, because you'll begin to have the physiological changes that you'll recognize for you. And it really doesn't take a lot to get there, because you also, like I said before, you don't want to overwhelm the system. So when you first begin this work, it's just paying attention to those areas where you have a lot of tightness or tension. Now, in relationship to the abdomen, that's easy. Giving yourself a nice, relaxing abdominal massage does wonders, right? Massage your belly, and then people say, how? And my tongue-in-cheek answer is the same. Yeah, just stick your fingers in there, start massaging it like you would your leg, and just begin to move things around, and you'll likely notice that it's probably tight, pretty tender in there. And the reason that is because you've got a lot of backed up lymphatics there and extremely poor blood flow in the gut and tightness in what they call fascia in that region. But there's a lot of clusters of nerves that live there called ganglia. They live right along the back of the belly. So if you can rub it, slap it, tap it, I like to put vibration in that region is one of my favorite things to do. Like if you can get a small little vibration ball, a ball that vibrates at different speeds, and you start to put that all over your belly, you're going to change your life. That's going to really make a big difference for you. Don't use the massage guns in there that look like a jackhammer. That's going to be too aggressive for you, and it's going to put you in fight or flight. You need to do more gentle type vibration massage every single day. And you can also put red light on the abdomen. So red light's kind of popping up everywhere. And the reason it's popping up is because it works. And red light over the abdomen is fantastic as well. And then along the spine, you can do the exact same thing. Now, one thing that really helps the spine is just getting better mobility in your spine and your rib cage. As many people are very tight and restricted because they sit all day, they don't really twist and rotate much. They don't reach overhead and hang and let the spine go into extension. And very few people actually know what in the hell diaphragm breathing is. So most of the population doesn't even do it. So getting mobility in the spine, you can see a lot of ways to do that just on YouTube. But I love vibration and light along the spine as well. So you would actually take that same vibration ball and run it along the spine on both sides and then throw some light in there. You get those two areas in there. Those are the homework assignment that I give to every person who comes to see me. Those two. You start there, right? And you'll start to shift the needle in many, many different other areas. And I know you will because you're going to feel it, first of all. But I also know you will because that's how physiology works. It just depends on where you're doing your light and where you're doing your ball. Does that make sense?
Yeah. And how, this is the classic question that I would always ask and everyone asks, how long would you spend like each day on doing that, like to make a difference over time if you're doing it consistently every day?
That's a great question, and I'm going to give the answer that infuriates everybody. It depends. And the reason it is because it's true.
Mm.
It's highly individual.
Mm.
I'll tell you this, more isn't better, better is better, right from the get-go. And I want to cycle back to the original thing we were talking about before of too much of something, even though it's good, can overwhelm your system.
Yeah.
And I know human behavior that if I give you a lot of stuff to do for a long time, you're not going to do it. You maybe do it for a day or two, and then you're going to quit. That's just how it works. So I start you off little and often over the long haul. And what I tell people is this: start off easy, build your way up. And I say, can you give me 2 minutes of some vibration and massage on your belly a day? Is that doable for you? Most people can say, yeah. And I'm like, start there and see how you feel. And then I would devote the same amount of time, maybe a little longer, to the spine because it's a bigger area. And then I would say, listen, if you can't do both of those in a day, just start with one. And then next day, do the other. And then you can mix them up. And then here's what happens. They do it because they have the time. But then they start to notice, wait a minute, this stuff actually works, man. I'm feeling a little bit better. And then they say, I think I'm going to do a little bit more. Now you have buy-in because their body is showing them that, yeah, you're in the right spots, first of all, but now I'm going to allow the changes to happen. So in the beginning, I usually tell people, 2 to 3 minutes a day on each spot daily, if you can do it, is a good start. And Eastern medicine, which I've studied a lot, particularly Qigong and a lot of things in Ayurvedic medicine, is if you can take time to massage and rub around your belly 20 minutes a day, you'll change your life.
Wow.
And it will.
Can I just ask with that? So, well, actually, and the spine as well, practically, do you need someone else to do it? Or are you kind of just sitting there doing like that? Do you know
The
what I mean?
spine?
Yeah, yeah. Are you doing it yourself or are you?
Yeah. Well, the easiest way and in a perfect world is that if somebody can do it for you, because it's really hard to reach around and hit those spots. But you can use a wall to lean up against, just like you would if you're trying to roll up against like a lacrosse ball or a tissue ball to do trigger point work. Some people may be familiar with what that is. Or what I usually do is I have them lie down on their bed and then they just kind of shimmy that ball all along the spine on one side and then all the way down on the other. And then that way you can have some cushioning from the sofa. Let's get the mattress.
Yeah.
And it gives a little give to it. And then you can lie down and move. And how you twist yourself can change the variability of how much pressure you're putting on the ball.
Mhm.
Lying on the floor will be too intense because you don't have any give from the floor.
Mm.
And I like the one on the bed because even when you do it against the wall, you have to use a lot of musculature to stabilize your core so you don't fall against gravity. So you can relax a little bit more when you do it.
And that's a vibration ball that you're using, or just a ball?
Yeah, it's just a ball that vibrates. There's a few tools that I have are mandatory
Mm.
for people seeing me, and a vibration ball is number one.
Mm.
I love that much that I actually created my own vibration ball called the Mojo ball because I just got tired of sending everybody to get other balls. So I
Right.
said, get this ball because I designed mine with the speeds and the size and the texture and stuff like that. But you can go on Amazon wherever you are and just get because I don't sell mine on Amazon. I only sell mine in the US for now.
Yeah.
Um, you can get any ball that vibrates, and it's different than a percussion gun. So percussion is not vibration. That's different. So you start with the vibration, and then what you'll notice is the nervous system automatically starts to calm down. Right?
Right.
And then it'll allow you to gently move into areas that you might have tightness or tension, or maybe your nervous system is also scared for you to get in there because it's worried about it hurting. And the abdomen probably will hurt when you begin to massage that, honestly. With the ball, it won't. But the reason it hurts, and it's not supposed to hurt, by the way, but the reason it is because you've got so much inflammation there,
Mm. And
the underlying inflammation.
with you mentioned qigong, and I mentioned like yoga nidra earlier, which is like less. You're not focusing on massaging and stuff like that, but it's still calming. I found both of those calming. I've started doing qigong out in Bali. Actually, been really quite powerful. Would you suggest to do those alongside these kinds of things? And if so, would you do the massaging and stuff before, so you're even calmer going into those? Or what do you think of those exercises?
Yeah, that's a great question. Ideally, in a perfect world, it would be nice if you can get into those regions before you do the other things,
Mhm.
but it's certainly not mandatory. Uh, I would be fine with if you just did those things at some point during the day, even on their own, because it's also going to feed into whenever you do your qigong or your movement or your exercises. And we may have talked in our prior podcast, I'm not sure, but I teach a lot about the lymphatics, of course, and I teach what's called the Big Six, where you massage and release and stimulate the six biggest areas of the body where you have clusters of lymph nodes that usually have inflammation in them to start to clear it out. And I tell people that you should work that before you do anything else, for sure. So Big Six should always come before any physical activity. And then if you want to throw in the vibration of the ball, but here's the best thing. You can use the vibration ball on the Big Six.
Mm. Okay.
And spot number 4 of the Big Six is your belly anyway. So you get that. But if you can put that vibration ball along your spine before you uh, move or train, that's really good because you're going to influence blood flow in your spinal cord. That's super good. But the vibration will stimulate what they call proprioceptors and mechanoreceptors in the joints. So what'll happen is that they send signals up to the brain of awareness and sensory awareness of where your spinal joints are when you move. So, one, it's going to make you a better mover because you're improving blood flow. It's also going to make you a better mover because now your brain knows more where your spine is when you move it, right? So you're actually going to have more resiliency and less of a chance of injury because of the blood flow and because of the what they call proprioceptive awareness. And when your brain knows where the body parts are, it'll let you move like a monster. If it doesn't know where the body parts are, it doesn't want you to move because it doesn't know where the body parts are. Does that make sense?
Yeah.
So one of the strategies that it uses to not let you move because it doesn't know where body parts are, is tension. So it tightens you up so you don't move.
Mm.
And the reason it tightens you up so you don't move is it's trying to protect you because it doesn't want you to get hurt.
Mm.
So that also feeds the TMS. And so tension myoneural syndrome gets fed at a conscious level and an unconscious level. Both. That's what people need to realize.
And
Both.
can we talk a little? You mentioned the big six, and is that more? You mentioned doing that before ideally before the stomach and the spine. Is that part of the calm step one?
Yes.
Yeah. Okay.
So what happens is it's also going to move the hell out of the fluids. Step number 2.
Okay. So it kind of combines both of them.
Yeah, it does, because what happens is that when you move the fluids, you also calm the body.
Yeah.
Now, let me explain why. Because if you don't have good fluid flow, particularly blood flow and lymph flow, right? Then you're going to have inflammation, right? And inflammation sends its signals into the spinal cord and up to the brain, and that feeds TMS. That feeds sympathetic dominance, right? So if I can move those fluids and calm the body at the same time because it's going to help take you out of fight or flight, well, then that's the 2 steps that I need for the body to have a better chance of healing itself, right?
Mm.
Because I was looking at all these people are doing things to try to help themselves with these therapies, and they're not really getting better. What's missing? Like, why? And my approach is you're missing your body being able to actually calm itself, and the fluids aren't moving. And you cannot have one without the other. They always go together, right? Because you can feel calm, but it doesn't mean that inside your body, the signals going to the spine from all the tissues is calm. Does that make sense? Like, you can feel calm in your mind, but your brain and your spinal cord are taking in trillions of bits of data and information from everywhere in your body that you're not aware of. Right? I mean, you're not thinking about the blood flow in your lower back that's not there right now because you're talking to me. But your spine and your brain sure as hell knows it's there. Right? Now, what if you have 10,000 things going up into your brain that's sending signals like that? Well, that's going to feed your stress response, even though you don't know it's feeding your stress response.
Mm.
So in my world, what I do is I don't go after the areas where you have your pain. I go after the areas that are painful, but you don't know that they're painful. Because those are the ones that are keeping you in pain that you can't get out of. Because trust me, I'm going to tell you right now, if you have knee pain, I'm going to find about 10 other spots on you that hurt more than your knee. And you're like, yeah, but they don't hurt. My knee hurts. And I'm like, well, when I stick my finger in there, they're going to hurt. And that's because you have inflammation in there that you didn't know about. But your subconscious mind does know about it because it's always going in. And that, my friend, is what's keeping you in fight or flight. It's all of it. The body's one piece. You cannot separate it into parts. I don't treat parts. There's no such thing as a part. It's an entire unit, and all these systems must work together. And when you do this long enough, you realize that pain is usually where a problem ended up, not where it started. There is a problem, usually really far upstream or downstream from where you're putting your finger. And then the only way you're going to find it, and I'm going to tell you this right now, the only way you're going to find it is through using your hands and being able to figure out where it is. And this podcast is to tell you the two biggest places that you're not looking now: your belly and your spine, particularly your thoracic spine. From thoracic 1 down to lumbar 2, L2. T1 to L2, write this down, don't ever forget it, is where your sympathetic fight or flight system lives. Right there. So you better show some love to that region. And when you do, everything else above it, into your brain and into your arms and into your feet and everywhere, is going to calm down, because that's where the signals are coming from, right? Everybody chases the end point of the signals. Can't do that. Well, you can, but you got to get caught in the quicksand when you do that. It's a two-way street. Stuff comes into the spine, stuff comes out of the spine. But I'll tell you this, if you have chronic pain, you have inflammation in your central nervous system. And that's that spine.
Yeah.
And that's why vibration and light will help you. But you have to do the belly too, because the stuff from the spine sends big, long nerves. They're called splanchnic nerves. You don't need to know the name, but it's like a big, long cable that goes into the sympathetics of the gut. And when your sympathetics and your gut turn on, guess what slows down in the gut? Blood flow, lymph flow. And when that happens, you get gut inflammation. And you get what's called leaky gut. And then when you get that, your whole body's going to be a flamed hot mess like that. Okay? That makes sense?
Yeah, no, definitely. And just for anyone who's listening, we actually did the big six. We did the big six. You showed everyone on the last episode. I'll link that down there because I think.
Do you want to ask any questions? We have time for your Q&A.
Yeah. We have a few questions. We are running out. We are running out of time. But yeah. So someone's asked.
Quick.
Yeah. Are there any tests that can confirm how well the lymph flow is working? Love that guy. Glad he's back on.
Oh, thank you very much. No, not really. There's no lymph test that you can do. You just have to go by how you feel, how the body looks, and how the tissues feel when you work it. That's the best way. Yeah, I mean, maybe they'll come out with some. They can do things where they inject some dye into you and take a look, but that's a lot to do to look at your the lymphatic system. So that one you have to go by how you look and how you feel.
Yeah. What advice do you have for people with neurological symptoms stemming from the neck?
First of all, work your lymphatics for sure, because you want to make sure that your lymphatics are clear so your brain has the full capability to drain the waste that's in the brain. Okay.
Mhm.
So neurological symptoms typically means you will have some type of neuroinflammation or spinal inflammation. So it still comes back to the blood flow and the lymph flow. And because the brain is only going to function as well as the environment that the neurons of the brain live in.
Mhm.
And that's controlled by the lymphatics and the vascular flow
Mhm.
of the brain and the fluid of the brain called the cerebrospinal fluid. Okay. But here's what you need to know. The cerebrospinal fluid comes from the blood flow, and the cerebrospinal fluid also dumps into the lymphatics. So all the fluid's the same. You're right back where you started from all the time. Blood flow and lymph flow.
Mhm.
Trust me, you're going to find your way back there with everything.
So we talked about someone's asking about lymphatic drainage, like massage, and like going to see someone, and I think that, they've been advised that they should do this maybe every week or two. But is that very different to what you're talking about? Well, not very different. Is it different to what you're talking about, where you're just doing the daily massage on yourself? Because I'm interested in this just because I've been myself, and it's very, very light, and it's kind of all over the body. Yeah, is there a difference there, or do you recommend those?
No, I recommend it for sure. It's the same, but it's different. So what do I mean by that? That you're always moving lymphatics when you do anything to the body, right? Sometimes they have to go really gentle and really light.
Mm.
Those are more, and so my approach is more forceful, more pressure work in the body. You need to go light when you have damage to the lymphatics, because the lymphatics can't handle a lot of pressure when they're damaged. That's called lymphedema. All right. But you can go harder in the areas when the lymph is not damaged. The only non-negotiable, whether you go harder or whether you go softer, is you have to stay true to the locations that you're working in. That's just based on how the fluids need to move in the body. That's why the big six is numbered 1 through 6, and you follow it in that order. And you don't follow it 6 to 1, because it's the wrong order for how fluids are trying to move. That's going to be your biggest problem. So I have a lot of leeway and pressure. I have zero negotiation for order. That can't change.
Okay. So if you're seeing someone who does lymphatic massage, they have to do it in the correct order, which is why it's important to see the right kind of person.
Yeah, if they've been properly trained in lymphatics, they'll know the order
Uh-huh.
to do it in, because that's the specialty to understand. So it's not like a regular massage. Okay,
Yeah.
you're gonna get a regular massage, and then that will move lymphatics.
Yeah.
But it's not as efficient as somebody who's targeting the lymph drainage itself.
Yeah.
Okay,
Yeah.
so yeah, they'll know, or I hope they know by that point, uh, how the pressures work and how it drains. But doing the big six every day like that, you're gonna stay true to how the fluids move.
Mhm. Do you have favorite supplements for lymph support? For instance, I've been told cleavers by others.
I don't have a really favorite supplement beyond hydration,
Mhm.
because those supplements gonna work for your lymph if you're dehydrated, because the lymph is about 90 to 96% water.
Mhm.
So if you're dehydrated, it's gonna be sluggish and it's gonna uh, suffer. So I'm not a big proponent of supplements in general, but the biggest thing that's going to help your lymphatics are hydration and don't eat crappy food. And I don't need to tell you what that is. Everybody knows what crappy food is.
Yeah. Yeah, that was actually the next question around like what role does diet play in your approach to healing?
Yeah, well, diet always influences everything, right? Because that's the only fuel energy system you're giving your body to work with, depending on what you eat. So, if you eat, yoo-hoo and ding-dongs and pizza, you're going to get crappy cells and you're going to have crappy lymph, as opposed to eating the more healthy option, okay? Whatever that might be for you. But here's what I ultimately want people to understand. Whether you eat a pizza or whether you eat a plate of broccoli, in the end, it all becomes waste. And that waste has to get out. So either way, it's going to be waste. That makes sense. So you still got to work your lymphatic system regardless, but you're better off most likely eating your broccoli as opposed to your fast food. So, nutrition plans, there's so many of them, and what may work for individual one might not be what individual two needs, at least at the moment. So I just tell people to try to eat a well-balanced nutrition plan that's not too restrictive on anything and cut out your fast food craps. And my experience, at least from what I've seen so far, I think the Mediterranean nutrition approach is quite helpful for lymphatics. That's probably my favorite up to this point. And intermittent fasting can work quite well for lymphatics. But don't just jump into that, everybody, because not everybody can tolerate intermittent fasting if you have metabolic disorders. So you have to check with your physician or your nutrition person first before you do that.
Mm-hmm. I'm sure the answer to this is it depends, but like how quickly do you normally see your approach having an impact with the people that you work with?
It will be depends, but it's pretty quick,
Okay.
honestly. So when you get these channels right, I have people notice a profound difference sometimes after the very first one.
Wow.
Yeah, like pretty quick. You'll definitely notice a difference if you stay diligent with it for a week to 2 weeks. Some people message me and say, "Doc, I'm doing it, but it's not really making any kind of change." So what that automatically tells me is it's not necessarily that it's not working, but it's not enough for you. That's a deeper lymphatic system block that you can't get from doing the big six. You have to go much deeper into the body because what's called the central lymphatics, the deep pipes along the spine, around the lungs and around the organs have the blocks.
Mm-hmm.
You have to do a different thing for that. Okay. So that's usually what that means. So if they say, it didn't really make much difference, that's usually what that means.
Mm-hmm.
You can help that. I just don't teach that, on the big six for anybody to see that they can go to. That takes more specialized instruction and education for you to be able to do that and understand it.
Mm-hmm. Awesome. Yeah, that draws the questions to a close.
Questions.
And yeah, look, really appreciate. Yeah, I think just as much now, if not more than the last time we spoke, I can sense your like passion and enthusiasm for everything you do, and yeah, really appreciate you coming on and sharing everything. It's I think it's quite a refreshing approach as well, like in addition to stuff that already people are doing. So yeah, if people wanted to reach out to you, ask you more questions, find out more about what you do, yeah, what's the best way for them to do that?
First of all, thank you very much. It's very easy to find me. I'm not hard to find. Just type in "stop chasing pain" anywhere on the internet, and I'll pop up somewhere. In my website for sure under "Stop Chasing Pain" as the name. And I spend a lot of time on Instagram. That's probably my favorite platform. So you can absolutely reach me there under Stop Chasing Pain. If you send me a direct message, I'll usually get back to you within a day. And I always tell everybody that I do all of my own social media. So you're not going to get some person you don't know replying to you or some bot getting back to you. It'll be me if you want to reach out to me.
Awesome. No, that's perfect. I'm sure you're going to get quite a few messages now. So, Perry, once again, thanks so much for coming on board. Really excited to get this one out there and keep doing all the great work you're doing.
You know it. Thank you, my friend. I appreciate it. I had a great time.